And so I think it's important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction about how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do. Hey, welcome back to Keeping It 100, where we have these open and honest conversations to make sure you have exactly what you need to make good and better health decisions. I am your host, Dr. Kristin Motley, and of course, we have an amazing show in store for you today. Now, Dr. Thomas is here. She's usually in the background helping me manage the chat, responding to questions, answering your questions and comments. But today she is going to come on camera. So Dr. Thomas, thanks for being here and live and in living color with us today.
No pressure. Hi, everybody.
George is coming. George is busy being Super George and Mr. Bro. And so he'll be here in a little bit. But Dr. Thomas, let's just catch up real quick. I wanted to talk a little bit about Thanksgiving. What did y'all do?
Went down to Baltimore where my mom still lives. That's where I was born and raised, and just kind of hung out there until Saturday, and then just hung out to get ready for Monday and the start of the work week after that. So nothing much.
How long were y'all down there?
We went down there at Thanksgiving, and then we left on the Saturday. So.
Oh, okay.
Yep.
That was a nice trip, nice getaway.
Yep, not too long of a drive because I can't do a long drive with them kids. But how about for you? What did you guys do?
We split up actually. So me and Noah, he's my 3-year-old. We went to my grandmom's to keep her company because she was not leaving her house to go anywhere. So I took her dinner over there. My sister came through on her way to work, so we just hung out over there with her. And then Bria and Bilal. Bria is my daughter. She's 11. Bilal's my husband, for those who don't know. They went to his brother's house with his family. So we did a little split up, but we had a good time. We all had a good time.
Fun stuff. Good to hear.
It was great. It was a 4-day weekend and it felt so good. I don't know how you felt about it, but I was like, I need to make some changes in my life so that I have permanent 4-day weekends. Like I can get my work done in 3 days. Give me 3 solid days, 10-hour days. Like I can bang out a lot. So I can take 4 days to do nothing, because that's what I did. I didn't open my computer. I didn't look at a single email. I didn't post anything. Like I didn't even advertise the show. I was like, I should at least advertise this week's show. But I felt like if I went to my computer, I was going to be triggered. And I was like,
you start looking at other stuff once you get on there. So
that's a whole nother thing. That's a whole other thing. But I just didn't even want to look at my computer. I didn't want to be triggered for work. And I'm just like, I'm in a good space. Whoever hop on, and whoever don't can catch the rerun. But I'm not advertising the show. So I hope people are on today. And if they're not, I understand why, because y'all didn't even know we was having the show today. I didn't want to touch it.
I'm with you on that 4-day weekend, but I don't know if the United States is ready for that yet. They still used to the 5-day work week, and
I probably about to add a day. The U.S. probably about to add a day to our work day, and we get 1 weekend day. That's probably what because they're moving in the wrong direction on like everything. So I don't know. All right. Well, I'm glad y'all had a good time. I'm just like grateful for that 4 days because it was amazing. But I just wanted so today's show, we don't have a special guest about a particular topic. I just wanted to bring everybody up to date on certain health issues and things that are happening in the world that's impacting us and just keeping us educated and informed. So that's basically what we're doing today. So the first thing I wanted to talk about was what China is doing with COVID. So if you haven't heard, this has been going on for a while. China has this zero COVID policy where they are just like, not accepting the fact that people could have COVID. They're like, nobody in China can have COVID. Now, China has 1.5 billion people, almost 1.5 billion people. That is a lot of people.
Mm-hmm.
COVID started in China. I don't understand why they think they can maintain a zero COVID existence and put in all these policies and regulations and restrictions to keep people locked in their homes. It is absolutely unbelievable, but they're doing it. But it's triggering an uproar. They have a lot of protests that are going on in different cities in China right now. There was a fire last week. I think it was last week. And it's believed that because of the tight restrictions that they are putting in place, the first responders couldn't get to those people in time to help the people that were involved in the fire. And at least 10 people died.
I heard the same thing. Yep.
Tragic.
Yep. Yeah.
That is tragic. It's just unbelievable. And I kind of feel like China is going overboard with these COVID restrictions because they caught a lot of heat in the beginning since COVID started there. And they are just trying to just go overboard with it and trying to make themselves look better than us. Like, well, we don't have as many deaths as y'all have in the US. I don't know what they're doing.
Yeah,
I don't know.
It's backfiring though, you know. I mean, I think it's one of those things that I think we see both ends of the spectrum, where we see some of our states where they went like, just do whatever you want to do whenever, like way earlier than they probably should have, and their numbers reflected that. And then now China is the other end, where it's like, no, like lockdown at any single kind of like uptick in COVID, and we see that doesn't work either. So I think if anything, it makes me feel better that like this kind of middle of the ground approach that most of the country of the US has been doing is probably the right way to go, because even if, you know, the data says you should lock down all the time, it's just not going to be realistic. I mean, people need connection and things like that. And so, and then it's a lot of other things related to just the politics of things. And I think it also shows too that there needs to be some autonomy and free will built in somewhere when these decisions are made with public policy. And we're seeing what happens at that other end of the spectrum and what's going on with China. And the protests are like getting bigger and everything from what I've heard. It really sparked something when those fires broke out. And from what I hear, at first the locals tried to blame the people who died in the fire and saying that they didn't respond in time. So like a lot of the no-nos, you know, they did a lot of those things. So just
a lot of that happens in China.
Yeah, I'm just think that we're kind of in the middle of where we should be, where we are still working on fine-tuning some things, but at least we know, like, just being back to where we were in April 2020 when everything was locked down is also not the way to go, you know?
Yeah. I think that the studies and the research shows that the masking works. This is a disease that is spread when you breathe. So if it's a disease that spreads from you breathing, if you put a mask on to block the particles that come out of your mouth when you breathe, you don't spread it as much. I mean, I don't even know if you have to do a study to prove that, but so, you know, China forcing people to stay in their homes and all the disruption, the supply chain problems that causes, the socialization problems it is just a bit much, even for me. I mean, I know that Bilal called me Lil Fauci, but even for me, it is a bit much. And it's crazy because you can't even find out how many people actually died of COVID in China, because I wanted to draw a comparison. Like, America has about 330 million people. We have about 1.1, I think, million people who have died of COVID. China has 1.5 billion people. They have so many people, but when you look at the numbers of people that died, it's like 6,000.
Yeah.
Like, it don't even make any sense. Yeah. It started there. They didn't even know what it was. I mean, I wouldn't be surprised if 6,000 people died in the first 2 weeks because they didn't even know what it was. Yep. So I don't know. Anyway, China's doing the most. We got to pray for them.
And getting nowhere with it too. That's the thing about it. Like, it's not going away. Like, if they wanted zero zero COVID cases, you should have eradicated it a long time ago. So that's the other part of it too. I mean, I think this virus has shown that it's going to, produce different variants, and you just have to kind of, deal with it as those variants pop up. And hopefully they'll figure it out sooner than later and come up with a different plan,
It's definitely not going away. So, I mean, I'm hoping that they pivot really quickly, like you said, and, figure out some other way to contain it and keep the deaths to a minimal, because it's not going anywhere. It is here to stay, and it's going to try to get better and better. So that's a whole nother issue. I don't even want to think about it. I don't even want to think about it. The other thing I wanted to mention today was, I heard on the radio actually this morning is that Twitter, we know, was bought by Elon Musk, I guess about a month ago or a few weeks ago. I don't know. Time is just crazy right now. But they canceled their COVID misleading information policy. And so they had this policy in place so that people wouldn't put information up on Twitter that may not have been confirmed to be true, that, that could have cause more harm than good when you just spreading lies like people like to do. And so Twitter had a policy that, that they had employees that would look, and I guess they would pull things down, suspend accounts, or censor information so that you're just not putting out any information on the internet, which I have mixed feelings about. I feel like it's responsible when it comes to COVID. But I wanted to ask you, so, what do you think about Twitter and different social media platforms, I guess, controlling what gets out there? How do you feel about that? Or do you have any thoughts?
Well, so I'm not a Twitter person. I am social media like LinkedIn, Facebook, things like that. And so, but I was never one. I guess I do social media. Well, with LinkedIn, it's kind of some entertainment LinkedIn with did not mean that pun, but like kind of sprinkled in with like connections for professional reasons. But I never really looked at social media as like my main news source, where I guess apparently some people do.
Everybody does, girl. Yeah. Everybody, it is the news source. Yeah. Like it really is the news source. So I was in I started working with a marketing consulting firm, and one of the leads that's assigned to my account had said that people are using Twitter like they used to use Google and Wikipedia. I mean, no, TikTok is like the new Wikipedia and the new Google. Like if you want to find information out, you put in search in TikTok, and whatever you find, like that is where people are getting their news.
I can't even believe I'm here. Oh my God. Yeah. So that's
like, what? Yeah. I'm not even on TikTok. So like I'm trying to get information out now. I gotta get on TikTok. But it's just like that is where people, it is literally where people are getting their news is from social media.
Yeah. It's funny. I've heard kind of just conversations about this. I listen to a lot of NPR because I have a long commute driving in and everything. And the one thing that needs to be kind of figured out over the course of time is, okay, well, social media, when it first started, it was meant to like, build connection and things like that. But now if it's moving into a space where people are getting their news from it, do you start adding in the regulations that come with being a broadcast corporation, right? So like there's fact checking that has to take place if you're a TV station or whatever the case is. And the social media companies have been able to like sidestep some of those requirements. Wow. And I think that this whole debacle with what's his name?
Elon Musk.
Elon Musk. I feel like this kind of needed to happen because I think people need to see this is what happens when there's like no checks on anything, right?
Yeah.
Like it becomes the Wild West, and it's almost like reader beware. And so I'm not surprised that they took away the restrictions. I mean, he kind of had hinted that was what he was going to do, and so now he has however many millions of dollars he paid for this company, and it's gonna like tank now because I think part of the draw to Twitter specifically, I can't speak for the other ones, is that I guess people felt like there was that level of trust with the blue check or with the information being reliable because it came from a reliable source. Well, now you can't even tell if it's a reliable source because you at one point you were able to buy the blue check. So
Yeah, I
I think
know.
it
It was just
shows
a
like,
mess.
yeah, like if it's unchecked, it's dangerous. And I'm hoping that the whole, market economics that go along with products will show that like it can't work unless there's a level of trust that can get embedded into whatever the platform is going to be.
It's scary, especially for us as healthcare providers, to know that you're getting your new. I mean, people have been doing this before, and this is why you see so many people that don't want to get the COVID vaccine. But it's just really scary that people will get their news from social media that is not fact checked, it's not checked. It's just I believe something, I'm gonna make something up, and people do this because they want to cause confusion. I'm going to put it out there, and because it's there, you believe it, and then you get these thoughts in your. It's just unnecessary. It's just too much. But the other thing I wanted to mention about Twitter is that he fired a bunch of people.
Yeah,
when he started, and like over the last couple of weeks, a lot of people have lost their jobs. So I think they're down to like half or something like that. So that they don't even have the capacity to fact check because they don't have the employees. So Elon Musk,
that's who he fired. He fired, if I'm not mistaken, that was the first round of firings were the fact checkers. So I mean, this was like an intentional thing, if I'm not mistaken. Yeah, it was like that was because he wants it to be free speech, and again, so it's like, okay, free speech, but if you're going to act as a media company, you need the reins that go in with like the rules of being part of the press or whatever it is. And so I don't know.
Wow. I didn't realize that was the first round.
I think so. Yeah.
If you have a change of heart, Elon Musk, and you decide that you want some fact checkers, I'm always looking for a gig. I'm always looking for a gig. Dr. Thomas might want to hop in and do some part-time work too. So, come holler at us. We want to make sure the right information gets to the right people. We got you. Another thing that I heard recently, which is a little scary, is that 40 million children miss their measles dose this year, which is
I was not aware of that. That's crazy.
Scary around the world. So this is worldwide. 40 million children. Remember, measles have 2 doses. You get one, and then you get the next one. So for parents, please check your children's records, check with their pediatrician to make sure they are up to date on all of their vaccines. But there is not a lot of measles in circulation, and a lot of that is because children have been vaccinated. But when you don't have the same rates of vaccination and they start to drop, then you start to see the diseases pick up. So let's not go backwards. Let's keep moving forward. We've been doing good. There were no cases of measles in the US last year. And I think this year there were about 50. So it'll pick up the more that children are not vaccinated. And we have a lot of travel that's international, and it's overwhelming sometimes. So please, parents, check your records, check your kids' records, check with their pediatrician, and get caught up. I'll be honest, when the pandemic first started, I didn't go to any doctor's appointment. I didn't take my kids no doctor's appointment. We want they fine, they healthy, they home.
Understandable.
Noah was a baby. He was 1, and he didn't get his vaccines because I wasn't leaving my house unless y'all was doing the vaccine clinic outside in the parking lot. I'm not coming in that office picking up COVID or nothing else. So he didn't get his vaccines, but then he had got sick. I don't even know how he got sick, but he got sick, and it caused his blood sugar to drop because he has this condition. But anyway, I had to take him to the ER. So he ended up spending a week in the hospital. And before they left, they were like, oh, we noticed he hasn't gotten these vaccines. And they gave them to him before he left. So that's how he got caught up. But he was behind too. So parents, it's never too late to catch up. It's never too late. And it's never too late to catch up on your COVID shots either. So if you only got 1 dose, you can get your second dose at any time. Please move forward. Did you have a question, Dr. Thomas?
Yeah, I was going to ask you. So how is his pediatrician linked to where he was at the hospital? So how were they able to see that he needed those vaccines?
Yeah, so he goes to Nemours for his primary care, like his pediatrician, and then I took him to Nemours to the hospital.
Okay, yeah, because I was going to say that because I feel like that's like a big lifesaver when it comes to some of these things, and when you get lost, lost to follow up, as they call it, as the medical term, like when you aren't like you missed your routine follow-up and then you haven't gotten back into the swing of things. It's nice when you have one-stop shop of like being able to go to like urgent care in the same place where your primary care is, because they can see the record and they were able to get him caught up. But could you imagine if, you know, your primary care provider or his pediatrician was not linked with Nemours, and then they had that hospital stay, and they still wouldn't have known, or they would have said, "What shots does he need?"
Yeah, exactly.
I don't know. Yeah.
Call his doctor.
So I'm glad that they were able to like use that, like that integrated system, as they call it, and to be able to realize that he needed to get caught up. So that's good.
I'm glad too, because that was the only way he was going to get him. So, but here's what happened on the back end. So when he did go back to the doctors, they and I like it because they will check you in, and then you go in the back, and if you do for vaccines, they already laid out. Like, this is not a conversation or you going to be getting, no, they are laid out and waiting for you. And so I like that they do that, because these kids need to get their vaccines. Yeah. So we walked in the room and he had like 4 or 5 vaccines laid out. And I was like, what are these for? And they said, because he never came to get his shots a couple months ago. And this was a week after he got out the hospital, because I had to go to see her to follow up. And I was like, no, he got him in the hospital. And they were like, oh, we didn't know that. And I'm like, how do y'all not know that? Like, ooh. So that's the part that really made me upset. Because if I didn't take him to the doctor and my husband took him to the doctor, my husband probably don't even know that he got the shots in the hospital, because I was there with him the whole week. Yeah. So he probably would have let him go ahead and get the shots. He may have called me. I don't know what he would have done. Yeah. But that really concerned me. And I meant to write a letter to the president, but I didn't get around.
It's never too late. Go ahead and write it. Because that's
I need to write my letter. Ooh. I do. I do, because it's an unnecessary exposure to additional vaccines. It's money wasted, because now who gonna pay for these extra doses that was given that didn't need to be given? Mm-hmm. And it's just like a medical error. So yep. I do need to write my letter. All right, I'm gonna do it. I'm gonna do it because I think they have like a hospital side and they have a primary care side, and they don't talk. So you got to look on the hospital side and look on the primary care side. I think what the hospital did, because they knew that kids were behind on vaccines, they took a look at the primary care side to say, hey, he didn't get these shots. Let's give them to him in the hospital. So they were documented in the hospital system, but then the primary care system didn't look at the hospital records. Yeah. I don't know. Anyway, he ain't getting no double vaccines.
Thank goodness. Yeah. Oh my goodness. And sometimes it takes that one thing to happen where some people will say, okay, I'm not getting any other vaccine. So it's like, we have to make sure to know, let's not do that either. Like, thank God that was averted. But, just remind you, you always got to be vigilant with like going into like the health system and with your kids, yourself. It's like, yeah, you gotta pay attention. So thank God that you were there. And because I don't know if my husband would have thought to call me either if that situation were reversed. So,
yeah, I know it's hard to say what they would have done. Yep. I mean, I want to give them the benefit of the doubt, but for real, I just don't know. But yeah, so people, please be vigilant, ask questions. Like when something don't seem right, ask about it. I'll give you an example. Last week, I had to get a pelvic ultrasound done because I have a history of having fibroid tumors. So I had to get it done to check up on that to see what's going on. So the ultrasound technician put like the probe on my stomach on the right side. Now I know that the prescription said like entire whatever. And then she said, okay, you can get up now. And I was like, well, why didn't you do the left side? Like, are you just trying, like, don't be trying to set me and my fibroids up. Well, what happened to the left side? She said she could get the view of the entire area on one side. I don't know. I was like, okay, thanks for letting me know.
Well, good that you asked though. Like you wanted to double check, and then they know for the next time around. Okay, like this patient's the one that's going to ask. Yeah.
Listen, I was like, you know what? I'm paying good money for this ultrasound. I need to know why you're not getting both of my sides done. So people like ask questions when it don't seem like it makes sense. Just ask to get knowledge, to get clarification. Now I don't gotta waste nobody's time asking why they're not doing both my sides on my ultrasound no more.
And they will appreciate that you're asking. Like, I mean, I feel like maybe the old school docs were a little kind of like, why are you asking me? Like, this is what it
Yeah,
is. But the new group of people are so much better, and they want you to ask questions because they want to make sure that they're like getting through and everything. So yeah, like, please do that. And then again, that shows them, because I will say, I know, like, I work with patients, and I know the ones where I'm like, okay, yeah, like, they're going to double check. And then I know the ones that aren't, and I have to remind them. I'm like, ask this, ask that, like, so get that rapport with the doctor or the provider, so they know, okay, you're the one that's going to be vigilant. And then that helps them to like even be a notch higher on making sure they're giving you additional information and everything.
exactly. That's a really good point. So please remember, y'all, please stand up for your rights. Stand up for your rights. Other thing I wanted to mention, I don't know if a lot of people know this, but this came out a while ago, is that COVID vaccines are now a part of the vaccine for children program, which means that if your child does not have insurance, they can get the vaccine and the government will pay for it. A lot of people were saying that that because it's a part of the vaccines for children program, that now you have to get it before school and all this other misinformation was going out, but that's not true. The only thing it means is that if your child does not have insurance, they can still get the COVID vaccine. You don't have to do it. I recommend you do, but you don't have to do it, but you won't have to pay for it if you don't have insurance. And I also want to mention, while I'm talking about that, is that a lot of people are going to lose Medicaid coverage once the pandemic is officially over and it's not considered a public health emergency anymore. That could be coming up within the next few months. So people that were eligible during the pandemic are not going to be eligible once the funding to support the pandemic is over. So please make sure you follow whatever guidance comes to you from the state. If they send it in the mail or email, I don't know how they send it, but they should be sending out some information. I know that we're supposed to know 60 days in advance when it's going to stop, but stay up on it, because you don't want to end up in the hospital for any reason or get to a doctor's appointment and realize that you don't have coverage. That's going to cause a lot of frustration on your end. So make sure y'all stay up on if you are still eligible for Medicaid or not. I know that they said that a lot of people are going to have to recertify during the time when they cut enrollment for people. So just make sure you got your documentations in order, call over to the welfare office and make sure that everything's in place so that you don't have any delays or gaps in care. Dr. Thomas, did you hear anything about that? I'm not sure.
I hadn't, I'm sitting here like learning, and I'm just thinking, I can't imagine, like, with everything else going on with life. And then now there's this unexpected, like, at least if you have to recertify during a normal cycle, when it is, you can plan for it like that. That's just interesting. But, and I guess now we are going to have a change of Congress. So I'm not sure that's going to, I don't know where these extensions are going now that we're, I feel like I'm the one that keeps bringing politics into things, but like, I just don't know if we can expect it. Yeah. I mean, so just something else to think about too with, how this is going to play out. But no, I was not aware, and I'm glad that you shared it so people can already start thinking about having things in order and everything.
Yep. And for people that do lose coverage, you can go to the marketplace to get coverage. Right now is the open enrollment period. But if you lose coverage throughout the year and it's not open enrollment, then that's the time to hop into a new plan. What's really important, and I don't know if this goes for people that lost Medicaid, but traditionally, if you lose insurance, you have 30 days to get on a new plan. If you wait longer than 30 days, you cannot get on a new plan until there's another open enrollment period, which can mean you can go 4, 5, 6, 7, 8 months and not have any insurance. And you don't want that to happen to you. So please realize, if you do get dropped from Medicaid and you don't qualify to get back on, you can go to the marketplace, healthcare.gov, to find a plan that will work for you. I am reading that the plans are a lot more affordable than they have been in the past. And if you qualify for Medicaid, you should probably, if you previously qualified, through COVID, you should be able to find a plan that's affordable. So just be on the lookout for that, because I know that's going to hit the Black and brown community more than it hits other communities. So I just want to make sure that y'all are informed, educated, and just stay up on it.
Absolutely. And are there places that people can go to like get assistance with just like even filling out the paperwork and things? So I'm in a VA setting, so we don't deal with and I'm not a social worker. So, but our social work services are a little bit different. So I don't help people with getting connected with Medicaid and everything. So I'm just curious, like, are there like community resources that they can reach out to?
Well, I know that ChessPen helps people get enrolled in the marketplace. I don't know to what extent they can help you get enrolled in Medicaid, but I imagine they have a support staff there who can direct you. And I know that they do accept Medicaid. So if you're in Chester or in Delaware County, I would suggest ChessPen, which is on 9th Street. I might have their number. I do have it. Oh, look at me.
Look at you. Ooh, efficient.
I can't put it in the chat, but I can put it here. And Uncle P is on our show today. He can probably pop it over into the chat for y'all. So you can call over to ChessPen if you need help with insurance. Other thing I was going to mention was something else you said. Oh, if you're not in Delaware County, you can look for a FQHC. I'm just going to put FQHC is a federally qualified health center. So if you look for one of these in your area, you'll be able to find a health center that probably accepts Medicaid and can help you get enrolled in a marketplace plan if you need to get enrolled in a marketplace plan, or help you get a Medicaid. So I'm gonna pop that in the chat. So I don't have the link to the FQHCs, but I did put like what it means so that you can at least do a Google search and hopefully find some good information and not fake news, because apparently Twitter is promoting fake news. But anyway, I want to give a shout out to Kevin Yes God Thomas. So I was in a meeting a few months ago, and somebody mentioned that people are having a hard time following the directions in the home COVID tests. So I was like, say less. So I wrote up a little script and I reached out to Kev. I was like, Kev, can you act in my first feature film? He was like, absolutely. So I went over there and shot a video of him showing people how easy it is to use the home test. We have a little clip of that video that we'll play.
Firmly swab inside the lower part of each nostril for 15 seconds. Do not push the cotton swab far up your nose, only about a ½ inch. Do this for 15 seconds on each side. Remove the cotton swab from your nose and immediately place it in the collection tube.
Shout out to Kev. So that was it's about 3 minutes long, and you don't need to read the instructions. So if you have hard time reading small print, if you just can't read, or if you can't understand the directions because they're too complicated, you can use that video. I just popped it in the chat. Uncle P can grab those and put it out there for you guys so you can take a look at that. But I want to also give a shout out to my husband. He did the voiceover for it. He hates working with me because he says that I need everything to be perfect, and I do. So he be having to do it over and over. But he really did that in like 2 takes, which I was really impressed with.
Kudos
so
to
I
him,
did
yeah.
in 2 takes, he nailed it. So shout out to him. And let me give a shout out to Ashley Joseph. She is a pharmacy student at St. Joseph University, Philadelphia College of Pharmacy. That's where me and Dr. Thomas work. She is one of my interns, and she helped with the editing of the video. So thanks for doing that, Ashley. But yeah, so that's available. Please feel free to spread it and to share it if you know people that are having a hard time with that home COVID test. So it's the FlowFlex test. I thought I grabbed one, but I forgot to grab one. It's the FlowFlex test that we've been giving out throughout the county, throughout the city has been giving it out. So that's the one that provides the instructions for.
Dr. Motley, shout out to you for the scripts. Those scripts are so hard to write, having to do some for some of these classes. So give yourself kudos too. It's a group thing when it comes to these recordings that sometimes people forget. So that was kudos to you to have to, like, how long did it take you to write that whole script? You had it done in like one sitting, or?
I don't even know. All I did was I took the directions and I said, how do I make these directions easy? So I took the page out and I just started typing according to what they said, just to make it so that people can understand what they want you to do. Because they just put in all these words and don't do this and don't do that. You don't need that. Like, just do what I tell you to do and you're going to do it right. So I don't know, a couple hours, but it wasn't too bad. But your script, so I've been working with you on a course that you created, and your scripts are like legit. I mean, it was real actors involved. Kevin is not an actor. He's a film, he's a videographer, he's a photographer, he makes films. He stepped on the other side, so I appreciate him for that. But you had real professional actors involved in your scripts, and that was awesome. So I know that took a lot of time.
Thank you.
Yeah.
It does take a long time.
Let me think. The only thing I wanted to remind everybody is that it's a lot of colds going around. We don't know what's causing the colds, what kind of virus is causing it. So I just want to encourage you all to take care of yourselves, take care of your families. If you have a cold, I'm always going to say, wear a mask, sanitize, especially when you don't feel good, but do it anyway, because you just don't ever know. I think a lot of what we've learned through the pandemic is we have to do more to take care of others. It's not just about ourselves. This pandemic was not just about ourselves, because once you have COVID, you have it. It's nothing you can do about it. But can you help someone else? Can you prevent it from getting spread to someone else? That's what we're, trying to get people to do. And that's why we ask you to wear a mask, because you wearing a mask is protecting someone else from getting it if you have it, or in case you do have it. So just want to remind you all that tests are available. There are still some free testing sites up. You can get a free home COVID test. We're going to be at the Hive on Friday doing a COVID vaccine clinic, but we're going to disperse some tests there too. But use the free home tests. You can get up to 8 if you have insurance. You can get up to 8 from your insurance provider every month. Up to 8 every month. So I was at the pharmacy with 32 tests at the counter, because it's 4 people in my household. 8 times 4 is 32. So I was like, I need 32 tests. And they was like, who are these for? Here are the names, here are the birthdays, here's the insurance, process it. And I got 32 free tests per month. So I'm telling you, take advantage of this stuff, because when it's gone, it's gone. And I don't want to pay for COVID tests. So I just want them to be free. So test if you have symptoms, test if you've been exposed to someone that has COVID. They're recommending the test about 5 days later. And this is not about if you feel sick or not. This is about if you have COVID or not, because you don't want to spread it to other people who may not be vaccinated, who may not have gotten the latest booster. What we know is that people who are older, 65 and older, a lot of them are not up to date on the new booster. It's a new booster that came out a few weeks, back in September. And a lot of people don't know about it, and they don't have it, and they are dying. Yes, they've gotten their 2 doses, but they need to get the new booster for this protection. And those are the people who are dying. It's people who have not gotten the newest booster, people who have not gotten the COVID vaccine, especially when they are above the age of 65. And so you wearing a mask protects people around you. And so I just want to encourage you all to test so that you know if you have it. If you have it, follow the guidelines, stay home for 5 days, wear a mask for 5 days. And when you're in large crowds, wear a mask. There's just so much going on around. The flu and RSV is out there. It's around much earlier than it had been in previous years. Cases are going up, and the flu is really hitting people hard this year. It has been crazy. Younger people, like people in their 20s, teenagers, are like laid out for days with the flu. Get your flu shot. Get your COVID shot.
Is getting the kiddos too. It's gonna the Moors, they actually were advising, like, if you don't have to come to the ER, try to call your primary care provider first to coordinate care. My oldest also has like a specialist at Nemours, and they were saying, "Oh, did you get the message? Like, don't come to the ER if you can help.
Don't come around here."
Yeah. So a lot of the pediatric hospitals, so it's RSV too, and it's like really so. And I think I know you talked about this in a previous show. So you have the kids now who, under 1 and were just born, who they usually will get RSV, but then the kids like last year who were 1, and then back in 2020 when we were kind of on lockdown COVID, they're now getting it. So they think that's part of the reason for this surge. So more reason to mask, like you said, because there are other respiratory viruses that we kind of forgot about when we were all COVID that we have to like protect ourselves against. So
yeah, and you just don't know what it is unless you get tested. A lot of the urgent care clinics and the pediatricians and the doctor's office can test for COVID, flu, and RSV in one swab. And so it's good when you can get to a provider, but you may not be sick enough to go to a provider, and that's okay. But just wear a mask, just test, use the home test for COVID if you can. Just do what you can to find out what you have so that you're not spreading it to other people, especially if you have young babies for RSV, because it's the little ones that really don't do a good job handling that virus, and it sends a lot of them to the hospital, which is why Nemours is like, don't come up to this ER without talking to your pediatrician, because their hospital, I mean, they had been full for weeks. They just didn't have any beds because so many kids had RSV. It's just, it's a shame. But in any case, I do want to make a couple of church announcements. This Friday is a busy day. So we are partnering with the Foundation for Delaware County to offer a program on Black maternal mortality, which is a crisis in the US right now, which I didn't even know about until about 2 months ago. But we're doing a film screening of the film Aftershock. It's a really amazing film. It's a documentary of a Black woman who died a number of days after having her baby, and her mom and her partners fight to bring awareness and to get us on track so that our Black women who are currently dying 3 times the rate as white women around childbirth, it's just insane. So we're doing a program on that to screen the film, and then there's a talk right afterwards with professionals. The people who are the 2 families that are a part of the film are there to share. And it's going to be a good event. It's at Widener. It starts at 1:00. It's free. So it's free Friday, December 2nd, 1:00 at Widener in Alumni Hall. You just have to register in advance. I'll put the registration link so you can get it in the chat. Just click on that, put your information in and register in advance. And then right after that, so that ends at 4. Right after that, I'll be running over to the high to set up for the flu and COVID vaccine clinic. We'll be running that from about 6:30 to halftime. So as soon as halftime's over, we wrapping up. So come over, get your flu shot, get your COVID shots, your first or second dose, your booster. You can get your flu and your COVID shot at the same time. If you don't want to, I'm not going to judge you. Just come get something. Please come in, bring your children. We will be there to get everybody caught up on their vaccines. It's time for us as a people to catch up on this. Dr. Thomas, thank you.
Thank you
for coming
Thanks
today.
for all your work that you do. I always say that every time. Yep.
Oh my goodness, of course. I got to check in on Georgie Mink Jr. to make sure he's surviving out there. But make sure y'all tune in next week. We're going to have therapist Ryan McMillan back on to talk about depression around the holidays. We know this is a time where a lot of people experience depression because of loss of loved ones, whatever else they're dealing with. And so he is going to come on and share his advice about managing depression around the holidays next Wednesday at 12:15 right here on cmpradio.net. So come through next week. In the meantime, y'all be safe, and I hope to see as many people as possible on Friday. Thanks, Dr. Thomas.
Hi, everybody.